Despite a green light from the EMA for AstraZeneca, we had that limitation to over 60s. Conveniently, there were enough people between 60 and 70 to accommodate the supply of AstraZeneca, if we'll describe it that way. If a similar recommendation is made, though, when it comes to the Johnson & Johnson vaccine, we're staring down the very real prospect then of having vaccines sitting on a shelf and no one to give them to, wouldn't we be?
Yeah, that'd be a real shame. I think it's important to say when it comes to all four vaccines approved by the EMA, all four are very effective. They're roughly 100% effective against preventing severe disease and death. That's all four of them, and they have a very good safety profile. The clots that occurred in relation to Johnson & Johnson were very rare. I think it was 1 person in 3 million, if I'm correct, died as a consequence of one of these clots, and these clots are treatable. So the risks are infinitesimal compared to the benefits. But if we're not able to use it in the under 60s, the truth is that we will then be in a situation where we have hundreds of thousands of vaccines that we can't use.
The lack of availability, possibly when it comes to AstraZeneca, might make them more likely to give the green light to Johnson & Johnson. If it were to become unavailable, I suppose it goes without saying that we wouldn't hit that 82% target by the end of June.
It would make it very
impossible.
Virtually impossible. It would mean that we'd go from 4.5 million doses in Q2 that's arriving in Q2, not necessarily in people's arms in Q2, down to 3.9. So, and bear in mind this is a single dose jab, so. It would have a significant impact. It would knock us back certainly about 3 weeks.